Hi there, welcome to our presentation on our pharmacy revision series on inhaled corticosteroids. So, inhaled corticosteroids are used in COPD and asthma. They reduce inflammation and widen the airway. So, with people with asthma or COPD, what you get is a lot of inflammatory mediators release, which can cause bronchoconstriction, and taking steroids will minimize that. General side effects include headache, oral candidiasis, pneumonia in patients with COPD. Your taste is altered and you get voice alteration. Now, some of the key monitoring requirements are that you've got to look at the exacerbations that a person's had. So when you're in GP practice, for instance, and you've got patients who are on high dose steroids, um, if they've been admitted with an infective exacerbation of COPD, this is something that you can audit, and also looking at the usage. So when you're looking at patients ordering their steroid inhalers, are they actually using them correctly? Are they ordering them within the right time frame? Are they leaving a large gap and relying on their blue inhaler more? And then you've got the advice as per the NPSA with the recent steroid alert as well. Some of the further side effects that you need to look at with steroids is adrenal suppression, infections, which we've talked about, chickenpox, and measles. This will be covered in a more detailed presentation when we talk about the use of oral steroids as well. Now, some of the things that can be used to help you with your revision or issues that you may have come across in clinical practice is those that are on high dose steroids. So those that are on beclomethasone 1000 microgram daily or fluticasone 500 microgram daily, there's an increased risk of adrenal insufficiency. So this is where they require a steroid card as well. And obviously the long-term effects of taking steroids as well. Kelhale and Qvar. So basically with Kelhale, this has extra fine particles and it's more potent than your normal CFC beclomethasone containing inhalers. And again, Qvar has extra fine particles as well, and obviously this is twice as more potent than Clenil. So basically, you can't interchange between the brands. So when you are prescribing, make sure that you add the brand in there as well. Or if there's a query in a community pharmacy, you can ask the patient or look at what the patient has taken from a history in their PMR. Or if not, then you'd need to approach the GP surgery as well. Now, some of the practical points that you tend to have is counseling on the use of inhaler technique. It's really important when patients are initiated on an inhaler or they've had an inhaler long term that obviously you get the counseling perspective right. So are patients using the right inhaler? What kind of inhaler are they using? An MDI or dry powder inhaler? Now, if they're using an MDI inhaler, do they require an aero chamber with this as well? Do they clean this often as well? And then another thing that we're going to look at is the MART regime, and for those patients, what the MART regime is, what doses are required in the MART regime as well, and something which we're going to cover in a later on presentation as well. Thank you very much for listening to this presentation by CBH Education. Please follow us on our Facebook channel, Instagram channel, and also our YouTube channel for more presentations on the different types of medications in our pharmacy revision series.